Hi, my name's Jerry and I'm a paediatric speech and language therapist. I think when lots of people think of speech and language therapists, they think that we teach people how to talk. Our job is very different from that. It's much broader than that, and I think that communication therapist is probably a better way of describing the role. I personally work in a specialist unit for children with specific language impairment and autism. A typical day for me working with children, I would do some individual therapy, so I might be looking at a child who has dyspraxia, who has poor muscle control, and we would be doing some very specific exercises to improve their palate strength, their lip strength, their jaw strength. We'd be using different tools to get them to bite and chew and swallow. I might be doing some language work, so looking at concepts development, teaching vocabulary, looking at the way children produce sentences, looking at their grammar and helping them to improve that. And then I might be doing a social communication skills group, so teaching children how to hold a conversation, how to take turns, how to be a better friend. So it's fairly broad, the kind of work that you would do within a typical day. But the role can be very broad and very flexible. So some of my colleagues might work in a hospital inpatient, either with adults who have had a stroke or who have progressive muscular difficulties, possibly adults who are post-cancer carcinoma of the neck or the throat and having difficulties with speech or with swallowing. Some of my colleagues might work in paediatric units within a hospital, possibly in the NICU, in the neonatal intensive care, with new babies who are having swallowing difficulties, or again in post-cancer wards with children. Other colleagues work with those who are deaf, or children with cerebral palsy, children with Down syndrome. So a really broad spectrum of both sites that you can work in and the kinds of caseloads that you work with. Lots of newly qualified therapists will work in the community, so will work possibly in a health centre or a community clinic, seeing more or less anybody who works in the door. And then often as therapists progress through their career, they specialise in something that interests them. So hence I've specialised in quite a small area of communication difficulties. I did a 5-year undergraduate honours degree in England. The routes into speech and language therapy is either a 4-year undergraduate degree or a 2-year postgraduate master's degree. It's fairly competitive, it's quite difficult to get in, particularly to the postgraduate courses. It's a very popular degree, and it's fairly intensive. I think if you speak to most speech and language therapy students who are in the course, I think it is a fairly full-on, intensive, quite clinically strong course. But yeah, really satisfying. I think that the people who both do the course and have the career, there's very little problem with retention, because most people who become speech and language therapists stay speech and language therapists. I think for me the huge advantages are the flexibility of the job, that particularly as a woman you have the flexibility to work different hours, different amounts of time, you can work in different settings, you can have a term time only contract. It's very flexible, you're very autonomous. I think you definitely are responsible for your own decision making. You work as part of a team, but you are empowered quite a lot in that team, that you can more or less set your own agenda and do what you think is best, which for me really suits me, that I don't have to follow somebody else's protocol to every degree. So I think the flexibility is fantastic. I find it a very rewarding, satisfying job. You definitely are making a difference for me in children's lives, which appeals to my sense of social responsibility. I think the disadvantages, I guess, is that if you're most speech and language therapists are employed by the NHS, which has its own pitfalls and difficulties, and you are part of a cog in the big machine that is the NHS, which can be very frustrating, particularly when you move on to possibly take on a management role as well as your clinical role. I think that can be frustrating. Some therapists do work independently in the independent sector, and that's obviously more lucrative, but I think has its own challenges, being that the expectations of your patients is that much higher, so you're under different kinds of pressure, I think. But there is definitely space for working in the independent sector as well as in the National Health Service.